Dr. Simi, welcome very much. It's very good to have you.
Good morning. Fantastic to be here. Thank you, Dukwe, for asking me to facilitate this session. I'm actually quite humbled by it. I think it's wonderful to have the opportunity to discuss with our community, particularly about a topic that is so important, so important to us and to our well-being. Sadoh I've known for many years, many years, and she has been ever so consistent. And I think consistency is part of the attributes of a good mental health, actually, being able to be consistent at what you do and to continue going and be resilient. So I'm thankful for having you as a friend and for me to be here today. My name is Simi. I'm a practicing GP, and just like Dukwe said, I have a lot of passions. I'm multi-passionate. I do a lot of things, so I won't bore everyone with it. If you want to know a bit more, my LinkedIn page, my Instagram page, everything says everything about what I do. But very important to me is mental health and being open in discussing it, making sure that it's no longer a stigma, making sure that we can discuss our challenges and having the tools to overcome and to also thrive and to be happy and joyful all the time. So yes, as I said, it's a 3-part series. We'll be looking today more about exploring the link between our mental health and our physical health. We'll be looking at the linkages with things like race and culture and religion, really wanting to understand it, because what I found out is that we all just mental health, and we've not really dug deeper. And there's something about doing the deep work associated with understanding what this is all about, so that we're not just jumping on the bandwagon, but really understand why this is so important for us to break down. Then the second week, we'll be looking at our body's responses. So at the end of this session, we'll give you access to the online course, which will be basically reiterating what we've talked about this morning. And what I ask is that you go through that course, which is, it looks like a repeat. There's little videos. I've just done little videos, an audio version of it, so you can listen to it if you don't want to watch it, and to do the assignment for the next course, next session, which will be about listening to your body's responses. As a doctor of the last 21 years, I've seen so many illnesses that we can't get to the bottom of. And I promise you, a lot of them are linked to your mental health. So the next part would be us wanting to discuss, how do you present when you're stressed? How do you present when you're sad? You know, how can you recognize when you are depressed or when you're feeling low? Some people will have a headache, some will have chest pain, some will have stomach pains, and they would look for the solutions and they can't find them. You know, we need to slow down and really look at how our body responds to our mental health. And then you find that when you are really happy or joyful, then it's different. And then the last week will be about tools. That's when we'll now talk about how do we now really do the work? How do we tap into those tools that help us have a good mental health? Okay, so the first slide is just asking, what is mental health? What is mental health? I'm not bringing up the slide yet because I want one person to tell me what mental health is to you. So if one person can just share what is mental health, that would be wonderful. We have lots of medics in the room as well, so I'm sure there'll be a great definition from anyone. So what is mental health? I think Mommy's trying to say something, but you're muted.
Yeah. So to me personally, mental health is just the state of how we feel mentally for our everyday being.
Absolutely. That is absolutely right. So so mental health is a state of well-being, you know, in which you yourself, you realize your own abilities. You realize your abilities. You can cope with the normal stresses of life. You can work productively and fruitfully, and you're also able to make a contribution to the lives of others. So that state where you feel in balance, it doesn't mean that you don't have stress, doesn't mean you don't have troubles, doesn't mean you don't have things that cause you heartache. But despite all of that, you are in what I call flow, and you are in balance, and you're able to do what's right for you. You're also able to make your own decisions. You're able to have agency. Agency is knowing what you want to do, being able to do it without being influenced unduly by other people's opinions. And then mental illness, on the converse, is where you have all diagnosable mental disorders. So being mentally healthy doesn't mean that you don't have a mental illness. So someone can be depressed and have depression as a diagnosis, but have a very good mental health because they've learned how to deal with that condition. And as you know, it's a condition. It doesn't mean that it's like having diabetes, it's like having anything else. So someone might have anxiety, generalized anxiety disorder, or they might have schizophrenia, or they might have bipolar affective disorder, any diagnosable mental health illness, but they are so clued onto their condition that they are more mentally healthy than people that have no diagnosis. So what can cause mental health problems? So having a mental health illness is not the same thing as having a mental health problem or an issue that is affecting your mental health at that time. So what can cause mental health problems? I've given some examples of what can cause mental health problems there. Most commonly, particularly with Black women, it will be things like, microaggressions at work. It will be issues with your relationship, with your marriage. Maybe you've lost someone, maybe it's financial. With the children, our children usually are the biggest issues because we all want our children to be successful and to be well. And if one of your children is not doing well, you might have a bit of emotional stress. Is there anything else that I've not mentioned that could cause an issue with our mental health? Just shout it out if there's any other issues that have.
I think traumas.
Trauma, yes.
Like childhood trauma.
Childhood trauma is so important. And actually, just at that point, one of the things that I will hope that when you do for your assignment is to look at issues around childhood trauma and what's made you who you are today, and what's formed kind of mental health that you have. Childhood trauma is extremely important. Almost every single person in this room would have one form of childhood trauma or the other. So it's important to understand that. So thank you for shouting that out. Anything else that I haven't mentioned?
Cultural expectations.
Cultural expectations. In fact, that's one of the slides on this presentation. Cultural expectations is so strong because we almost, it's almost like a chain, like a shackle. It's there. You don't want to go outside it because if you go outside it, you are almost excluded. So being from the African community, there are things that are expected of you as a woman that if you're different, you're seen as not quite the right kind of woman, and because of our culture. And part of having a good mental health is being autonomous and having enough agency enough to say, you know what, that's not for me, and having your own determination to say, well, despite the cultural expectations, that's not really for me. As far as you are convinced and convicted within yourself. I'm not going to make this a Christian presentation, but as you all know, I'm a born-again Christian, but I'm not going to make it a Christian presentation. But what I'm going to say to you is that as far as you have your own, conviction within your spirit, then you can start to free yourself of cultural and expectations. Anything else?
Physical
Really?
health.
Physical
Physical
health.
health problems. Yeah, if you have
Yes.
like diabetes, pain, things
That's
like
right.
that. Yeah.
Yes. That's also in this slide as well. Physical health is a massive one. They're both linked to each other. Anything else?
And who run in a family?
Factors could
So,
be environmental, bad housing could
okay.
lead to that.
So socioeconomic issues, bad housing, no job, all of those sorts of things. Mr. Yele, you mentioned something I didn't hear.
Yes, who run in a family. Perhaps in the past, maybe some families have got it. Who run because sometimes you could have it from one generation to the other if one is not careful.
That's correct. So in terms of mental illness and having a diagnosable disorder, there are some mental illnesses that can run in the family, not just genetically, but even by the fact that you are in the same house. So, for instance, you might find that, oh, someone's mother has depression and they have depression, and goes on and on. Not necessarily because it's genetic, but because they've grown up in that environment and that's what they see, as opposed to things like schizophrenia, which might be genetic, and run in families. So, absolutely right. One more, and then we move on.
Unhealthy religious belief.
If that's also another slide, yes, religion. While religion is fantastic and religion actually is protective for our mental health, again, going into some beliefs that are completely just not, they're detrimental to your mental health, and being able to have that agency to say, well, I go to that church or I go to that mosque, they say some things, but actually I don't believe that one. And you are strong enough to say, I'm a child of God, but I do not subscribe to that way of thinking. It's amazing. I'm sure you've all seen on the news recently. There was something on social media about an actress or I think it's an actress that died a few days ago. And that whole thing around that, which was a very very unhealthy religious belief, where almost the whole world thought that this pastor had cursed this actress, and that's why she got ill and she died, and it's what she said. And in my mind, I was thinking, this is not of God. So yes, absolutely right. Unhealthy religious beliefs. Okay, so we'll move on. So what I want us to do, now that we know about what could cause problems with our mental health, is what are the characteristics of somebody you say is mentally healthy? Sorry, there's a little typo there, which I'll correct. Somebody who's mentally healthy. So when you look at someone and say, that person is actually very stable. They're actually very stable. You can't really pretend, you can't really act it out. So my close friends know when I'm under mental stress, under emotional stress. I tell them. But even if I didn't tell them, they would know. And also someone that you say, okay, actually she's in a very good place at the moment. So the first thing is you have a positive attitude towards yourself. We always say hashtag self-love. It's a real thing. You will find that people who are very self-critical have very poor mental health. Being self-critical is not a good thing. Being falsely modest is not a good thing. Oh yeah, no, I did that. Oh, well done. Oh yeah, it's not that good. I'm just trying my best. No, it's not a good thing. If you've done something that is commendable and you have been given a compliment, then it's mentally healthy and mentally balanced to actually say to yourself, yes, it was good and thank you. So they have a positive attitude towards themselves, a positive body image, a good self-esteem. They have, they just know that, they are loved. People around them love them. They are not paranoid. So that's one of the very, important attributes of a mentally healthy person. They are committed to personal growth. They don't think they know everything. They're willing to learn. They are always willing to grow at whatever age that they are. They're able to integrate into their community, into their society. Wherever they find themselves, they're able to integrate and they're able to just grow in that community. They also have autonomy, which I mentioned before. Autonomy and agency are very similar. So you're able to say, this is who I am, this is what I want to do, and you're confident enough to pursue that course. They also have a true perception of reality. So when you make a lot of assumptions, your perception of reality is not quite right. So it's okay to make a mistake. It's okay to say something that maybe is not right, but you're also able to ask the questions. You're also able to accept when you are wrong, rather than imagining what is not, which you find a lot of in things like paranoid schizophrenia, where people believe that somebody is listening to their conversations. They believe that somebody is out to kill them. Somebody has cursed them, this and that. That's having a false perception of reality. And it's not only in paranoid schizophrenia. There are people who don't have any of those conditions who strongly believe that the issues in their lives have been caused by somebody else. That's a false perception of reality. And lastly, they're able to master their environment very well. So they're adaptable and they have healthy interpersonal relationships. So they don't get into relationships with toxic people. They're able to recognize that this relationship is not good for me. This is very good for me. And even if it's not good for them, they're able to manage that interpersonal relationship really well. And just to throw it out again and make it a bit more interactive, what are other characteristics of people who are mentally healthy that you have noticed?
I said they are always very happy people.
They're happy, they're joyful, but sometimes, and even if they're not happy, they're able to recognize that they're not happy and say so.
Yes.
I think they're Timmy here. I think they're able to pick up themselves real quick. They're able to coach themselves out of certain ruts. So it's how quick you pick up yourself.
Yes.
Is a symptom of mental wellness.
So they are resilient. They are resilient.
Absolutely.
And they go through obstacles. They might be sad for a bit, but they get up and
But they pick up.
Yep. Yes. Anything else?
They don't stay in the rut.
They don't stay in the rut. It's the get up and move on. Any other characteristic that you've noticed? People who are mentally healthy?
They are balanced.
They are balanced.
Yeah, they have balanced view in life.
They have balanced views. I like that. They have balanced. You want to say more about that?
I think if you're mentally stable, like you say, you don't make a lot of assumptions, and you're able to,
Yeah, I can add that because I wanted to say was related to balance. It's even if they're going through grief, they are able to compartmentalize things. They can just say, fine, I am grieving, but there's food that needs to be done. I need to sleep, or this needs to be sorted. They can sort of like put things in boxes and be able to deal with them and still be thankful and still be positive and so on. That's like a balance. You are grieving, you are upset, you are stressed, but you can still do the normal day-to-day life and nothing goes, halt.
I appreciate that response. And I just to go into that a little bit deeper, when I deal with people who are depressed, who are very depressed, they are not able to get up. They're not even able to wash. They're not able to even, sometimes they're not able to eat. They're in bed and they lie in bed. They might lie in bed for weeks. That's one of the characteristics of depression, not being able to function at all. But that doesn't take away the fact that if you are grieving or you're going through, you might decide that actually I don't want to get up. I don't want to do anything and I need this time. But you're able to communicate that to your loved ones to say, I need this time to just be by myself. So I would appreciate some help with some of my responsibilities. So it's being able to be in tune with your emotions to the point where you can also communicate it. Maybe two more responses and then we move on.
They are confident as well. They're confident in their God-given abilities. They're not apologetic.
Yes, which is linked to the positive attitude towards yourself. You're confident in who you are and you're able to just sort of, not apologize for your talents or for your beauty or for your anything, just be, And one more. Okay, so I'm assuming that we've exhausted all of that. So we will move on. Right, so just looking at the link between mental and physical health, I think we already all know that there's a very, very, very strong link. If your mental health suffers, usually your physical health will suffer. And we'll come to the last slide, which is eventually about psychosomatic illness and the way our body expresses a poor mental health. When people are depressed and they're anxious, they're really not able to exercise, they're not able to socialize, and then that also leads to a decline in their physical health because we know that sitting down in one spot is the new cigarette smoking. Being sedentary, not moving, leads to, and you don't have to be obese because people think that, only when you're fat that you get ill. No, you might be as thin as a rake, but if you are sitting down and you're sedentary, it would lead to chronic illness. So that is important. It's important for us to focus on understanding movement as being very important. Now, 30% of people that have a chronic physical illness have a mental health issue. So if for us in primary care, we provide psychological therapies and access to everyone with a chronic illness. So diabetes, hypertension, any illness at all, there's a psychological element to that. And talking therapies is offered and is available, even though it's only 6 sessions, but it's available for people with chronic physical illness. And when your mental health is poor, it can seriously worsen a physical complaint. So you've heard testimonies of people who say they were diagnosed with cancer and then it disappeared. It happens, it happens. This is not to say that they didn't take medical treatment, but the medical intervention seems to work better when you have a good mental attitude and you have a positive mental attitude. Interventions tend to work better in that sense. And you also see people that no matter what you do, their illness keeps getting worse because they have a woe is me attitude. Everything is woe is me. Oh my God, why did I get that? Why is it me that got the cancer? Why is it me that this happened to? Why is it me? So no matter what you give them, it just doesn't work as well. They will I have patients that will come and say, oh, that medicine you gave me didn't work. That one didn't work. Everything does not work with them. I'm not saying that it's just their fault. I'm saying that maybe coming from a place of a positive mental attitude, believing that what you're being given is going to work, doing the work yourself, keeping yourself moving, having a routine, will also increase the efficacy of what you're taking. And there is research to back the fact that having a positive mental attitude works. This is different to toxic positivity, because there's a new term now that we call toxic positivity, which is in the face of reality, you insist that what is happening is not happening. That is not also advisable, and it's a form of poor mental health too. I'm just going to explore further about race and mental health. This is a big one, and it'll be great to hear your experiences, because I think we're all Black women on this platform today. And what would be useful for us to discuss is, what do you believe the impact of your race is on your mental health? Over the course of this pandemic, 80%, I think 60% of Black women have seen their mental health worsen. And 50% of Black women, see this need of their mental health as urgent, because Black women not only face discrimination on the basis of race, also on gender, and this have a significant burden on their mental health. And Victoria, please feel free to comment at the end of this slide about the racial disparity report, if you'd like to, and what your experiences is as an equality and diversity and inclusion lead. Black women have also seen the burden of childcare and housework spiral upwards during COVID. And that could also be linked to culture as well. And they're more likely than any other group. Black women are likely to lose their jobs, they worry about debt, they're struggling to cope. There also is poor access to emotional support. And where there is that access, it's not culturally appropriate or sensitive. Even for the best of us who are middle class or who are very educated, we still need culturally appropriate services. So just to have a little pause, Victoria, will have your views first, and if anybody else has a view on race and mental health, please feel free to chime in after Victoria. So Victoria, you've got the floor.
Oh, thank you. Yeah, everything you've written in is correct. And as you know, a lot of Black people face racial discrimination, microaggression, and all manner of racism and discrimination at work. And my role in reference to the report, we were not surprised when we saw the outcome of the report, because actually Tony Sewell, who was leading on it, we kind of know where it's coming from, and in state position from it from beginning. It's one of those Black people that refuse to see any institutional racism. So, and if you put somebody like that to lead on such big work, the outcome will be exactly his viewpoint. And unfortunately, Black people, we are very divisive, and a lot of the white people use that against us all the time. And obviously that's also have an impact as well on our mental health, because we're generally not happy, and we take it out on where we go, everywhere we go. and we don't speak out enough or talk about what we're going through on time because of this secrecy issue as well. And by the time we start speaking, the approach that we use sometimes is not right. So when our opinion are not being received the way it should. So my role really is to encourage Black people to work together and to be more open and to apply the principle of workplace. Read your HR policies, know what your rights are. And when things are not going according to plan, speak out, not in an aggressive way, not in the, and keep records, write things down as well, so that you can use it to present your case, as opposed some of the other approaches that we use. I'm not sure if that's, I don't want to waste time on talking about the report. So
that's really useful.
Yeah,
And
yeah.
got a lot of nuggets there. So I hope everybody heard what Victoria said. So I'd just like some more opinions on your experiences, or just comments on race and mental health. So please just shout out if you've got a view.
In the workplace, what I just wanted to make sure, what I wanted to mention is, in the workplace, normally when we do get our contracts signed and then we read what our employment handbook states, we normally do not pay attention to like certain things about, grievances or how to escalate certain things. So that's why usually we are always on the back burner. So something happens. I think part of it, some people are also ignorant because of maybe being a Christian, or you're a positive person. So sometimes somebody can be racist towards you, can be harassing you, but you say, I'll pray for this person. Maybe, let me understand where this person is coming from. And then by the time you realize that, there is an injustice going on, it's been going on for a long time, and hence the reason why people might not come through. So the solution could be just to educate ourselves about what our rights are in the workplace. There's a lot of diversity stuff that is going on. Just to read more, focus on that, get something, listen. And if you do find any young people that come in, we mentor them as well. Not that we're trying to start a war or, a resistance, but just to mentor people to, point them out to what they need. The same thing we do with newly married women. We mentor them into marriage. So the same thing in the workplace or anywhere else that we go in career places. Thank you.
That was really lovely.
And I would just like to share briefly, and to buttress what Pastor Victoria Lawrence said, because it's good to speak up early if you have issues at work. I've been through a redundancy before. That was years back, and it was very harsh. People were like bullies. It was a lot, and the managers, some of them were just terrible. So it affected me for a time, and I didn't look for work in my field for some time, probably a year plus. I switched into something else. But fast forward back to, I think last year or so, I had an issue with a colleague. She sent an email that was really bad. I mean, it was rude, and I knew it would affect me. Of course, she knew my manager had just left because she had an issue with the director and things like that. So I just thought, what am I going to do? I'm not going to take this, because they are like, they see themselves as a clique, or as the high powers, you can't touch them. So I spoke to one of the managers who is my color. And by the time I prayed, the Holy Spirit just said grievance, grievance, because I didn't even remember the word grievance, because they're grievance procedures in organization. So I spoke to her. She told me what to look for, like the other lady said, within the policies and all that. So I made a case. I sent it to HR, copied director. They scheduled a meet. They wanted to do it in a very, different way, but I insisted that no, these are the procedures, you need to follow it. When they wanted to bring a manager to the first meeting, who was our manager, I said, no, that will not be a fair process, because I know they're very tight. So I spoke my mind. You need to use this person or that person, because they will not, they're in different teams. And the meeting happened, and I was I was bold. I put up my face, and even the HR, she was like, no, even if you're stressed, Bumi has a lot. Safa is my name, a lot to do as well. She doesn't write that way. These are people that like they're untouchables. And I tell you, they've been there a long time, but I said, no, because you've been there 10 years or something, doesn't mean you can talk to me anyhow. You bring your values. I bring my value. You're not in my team. I will not take it. And truly, the other lady, the manager that encouraged, she was like, you're not doing it for yourself. You're doing it for others people as well, who cannot speak up. What you're doing now might be inconvenient. And it was, because I knew I was shaking tables. But at the end of the day, it worked out beautiful. She apologized. I mean, we worked well together, but she overstepped her boundaries. And I said, I will not take it. If I took it, they will continue that way. So they know, even my manager knows, oh, Bumi, you're very vocal. You tell them your views anyway. So that I will encourage anyone, speak up quickly, get support from any colleague that you know, they've been there a while, they know the system, the procedures or the policies. And I just thought, let me share that. Because my former experience, I said, no, this is not going to happen to me again. And yeah, so long as I do my work well, you can't touch me. So thank you.
That's thank you so much.
My mental health, yeah.
No, thank you so much for sharing that. And the most important thing I heard is that, you know, you take action not just for yourself but for others, and you demonstrated that you were mentally healthy, because many people would sort of buckle in the face of that kind of pressure, being under the spotlight, not being liked, being isolated, but you took that step. So thank you for sharing. So we'll move on because of time. So the next slide really is talking about religion and mental health. Religion, interestingly, religion can provide quite a bit of support, and people who are involved with some form of spirituality or religion or religious group generally are more mentally healthy. So that's a positive thing, I suppose, because religion gives you a community of like minds where you can work together, where you are both following a certain purpose. So it does protect your mental health. It's associated with lower levels of things like suicidal behavior or depression or anxiety or even substance abuse. However, it doesn't mean that we don't have where there is abuse in places of religion, and so we should also watch out for that. People that have high levels of religiosity also have better subjective physical health. They feel better because they are more mentally healthy. But we must be very careful. We must be very, very careful to not encourage abuse in religious organizations, because there are many examples of abuse, financial abuse, all sorts of abuse in religious organizations. And if we are involved in those organizations, please, when you identify someone that has a mental illness, signpost them to medical intervention. It's not advisable to keep on praying for them without encouraging them to go and seek medical intervention. So there are examples of people who are paranoid, and I had a patient who was constantly pulling out her hair. So she had trichotillomania, but she was also involved in the church, and she couldn't discuss it with anybody in the church. So because she felt that if she discussed that mental health issue that she had, she would be, isolated, which maybe wasn't even the truth. Maybe that was a false perception of reality on her part. But my point is, being part of a church, being part of a mosque, being part of any religious organization is mentally protective. And then things like prayer, meditation, silence have also been found to improve our mental health. Does anyone want to comment quickly on religion and mental health before we move on?
Hi, I would like to say that I think the Christian community, the churches, ministry leaders, they have to be engaged, and they need an awakening. They need to be, some enlightened, equipped to deal with and also to provide support to members of churches who have mental health issue. It might be, it's not advanced. It might be that it's really serious. It might be that it's just, a little bit, whatever it is, stress, depression, whatever, in whatever category, because sometimes people are truly isolated. They are, You know, they're just, oh, that person, you know, they just, you know, they, you know, people kind of, once they know, they don't really engage or interact with you. Leaders do that, not just the pastor ministers, but even their, you know, other ministers, deacons, where it's something the church, you know, there has to be a lot of conversation around that, because otherwise people with MH, you know, oh, things improve. I mean, their health will get better and all that. They will not find it, they will not want to access church. They might not really want to be part of that smaller group. And the way sometimes people talk to them at times, you know, as if, oh, you know, I mean, the same respect you'll accord to someone who doesn't have MH, you know, I mean, who have issues, might be different. I've seen it in practice. I've seen it, you know.
Right.
I've been at meetings. I've seen it.
I
So it's
appreciate
just
that.
something we really need to. Yes. It's not a nice thing, because those who have ME, they didn't ask for it. They didn't, you know, nobody asked to be ill.
Absolutely.
You know, and sometimes people just say, oh, maybe because they went on drugs, that's why they have ME. But that is the myth. That's not true.
I agree with you, Sapphire. And I think just to buttress the point, I think there's also a little mix between culture and religion. So for this slide, I'm strictly speaking about religion and spirituality, and not bringing in elements of culture, because in some organizations we have a mix of culture where there's also that stigma associated with mental health, which is more a cultural thing rather than a religious issue. So the culture is a big one. I thought I had a slide on culture, but anyway. So for people that are in churches, mosques, and the rest of it, it's important that we don't mix culture in, and we listen to people that have mental health, give them the same respect as Sapphire has said, try and destigmatize it. There are many people that have children with learning disabilities who are not comfortable to discuss it. So I teach, I've not taught for a long time in the children's church, and I know a couple of members of my class, one or two boys who had learning disabilities, and it was fairly obvious because the boys were getting very distressed by noise or by by things being rowdy, and I could see that this child had some form of autism, but the parents hadn't declared it, they hadn't filled it out on the form, so it was almost like having an elephant in the room, because I know what the issue is, I'm a doctor, I can see, but I really couldn't address it with the parents because they didn't want it discussed. So, and that might be a cultural thing, as the idea of wanting to protect your family and wanting to make sure that your children don't have any issues with getting married tomorrow or getting jobs tomorrow, which is really just cultural and not what we should be encouraging at all. We should be encouraging open discussions about mental health issues at whatever age. So just talking about the mind and body connection, I'm so sure I missed out a cultural slide somewhere, but anyway, let's continue. The psychosomatic illness, I wanted to just give a slide to psychosomatic illness and really want to hear your experiences with this, because it's very common. I don't know anyone that I know that hasn't had a form of psychosomatic illness. So what is psychosomatic illness? Which is, these are real physical symptoms that originate from or are influenced by the mind and the emotions. So anxiety, depression, emotional stress can all manifest in the body as physical pain. And the immune system can also be weakened by chronic stress. These are not imaginary. They're not imaginary issues. They require treatment just as any other illness would. So just again, we've got another half an hour before we end the session. Can anyone just share with me what their experience of psychosomatic illness is? Has anyone ever experienced a symptom that didn't really have a clear physical reason?
Yeah, yes. I can give you an example.
Okay.
When I lost my mom about 12 years ago. And around like the anniversary of the first anniversary of her death, I was very unwell. And I just kept going to the GP. And then we went through all the different symptoms, and he kept asking me questions. And every question he asked me, it was a no, a negative. Do you have this? Are you stressed at work? Are you stressed at home? Different things. And I just kept saying no and no. Excuse me. And then finally he said, have you lost someone recently?
I can't hear you anymore. Who was sharing just now?
Annie.
Annie, do you want to carry on, or are you muted?
Yeah, I'm here. Can you hear me?
Yes.
Yes.
Okay, so I don't know where I got lost anyway. So I said, so the GP kept asking questions, and then towards the end, he did ask if I had lost someone recently. And I said, oh, I lost my mom like a year ago. And so he went on to explain to me that towards the anniversary of a death of a loved one, you can begin to display some symptoms that, like you said, there are no roots to it. And once he did that, and he just allowed me obviously cry over it and talk about it, I began to feel better. But prior to that, I was at GP at almost every week, just feeling really, really unwell. And there was no root to that illness. So yes, it was really stress related.
Absolutely.
I think I have a very good example.
Yes.
Yeah, and I'm sure you remember this. If we're talking of the symptoms that originate from the mind. So at a stage in my life, I think from 2-3 years ago, I had a very, 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 should I say, fast-paced period of work. Work was super busy, lots of expectation. And I didn't even realize that I started to take maybe 2-3 cups of, coffee, including tea, in the course of a day. So in the background, I think I had a lot going. Actually, I think this was when my husband worked abroad. So a combination of him working away from home, me having to juggle work and all of that. So I had what seemed like a superficial palpitation on the top side of my left chest. So I think, Simi, that was what you called it after I troubled you a few times. So it was superficial in the sense that nobody could see it, but I could feel it. I had a palpitation at the top of my chest. It was worrying. I went to the GP, and I think on one of my visits to the GP, he was determined that I would go for an intrusive check. In my head, all manner of things were going on. Maybe this, maybe that, maybe that. I think on one of such visits, the GP just said, "What are you thinking of?" And that just startled me. What are you thinking of? What does your day look like? And then we started to unpack things. And I said to her that this is what a typical day looks like for me. Work is busy. I take 4 cups of tea, including maybe 2 coffees. And this is me that I don't even have capacity for Coke. So there's something about my body not liking anything that feels toxic. I classify Coke into that category. So if I struggle with Coke and I suddenly find myself having 2-3 coffees in a day, isn't that overambitious? Anyway, the GP then said, okay, let's start by you taking just 1 coffee in the next 2-3 days, and then let's review this. Sorry, guys, if you're hearing any background noise because I'm driving. So I went back home, and then I started to strip down my tea consumption. And guess what? By the time I returned to the GP, this feeling of palpitation had disappeared. The onset of anxiety has started to trickle away as well. And I started to gain a new level of awareness, which is, okay, instead of drinking 1 million cups of tea, what are other things that you could do to, pass time or to bring yourself back to the present when you think work is getting a better hang of you? So I think that's just one very good example I could give in terms of how you can have, symptoms that present themselves, in other forms that are actually not warranted, other than because of what is going on in your space.
Absolutely. That's a really, really good example. Okay, I'm going to move on so that we wrap up the session, and then we can have some time for discussion at the end. So just a quick recap. We've talked about various things this morning, so we all know what mental health is, and I'm very grateful that you all shared and discussed your different opinions, and the inputs is very, very valuable. I think we're recording this session, so Dr. Sister Jokwe hopefully will be available for everyone at some point. We know the characteristics of a mentally healthy person, the links between mental health and physical health, relationship between our race and mental health, culture, religion, mental. I think we didn't talk enough about culture, but we can always delve a bit more into that at a later session. And then psychosomatic illness. So just to wrap up, I'm not sure if there's anything in the comment section, but let me stop sharing so I can talk about what the next steps are. So please keep an eye on the comment section if there's any questions in there that we can answer. But what we want to do after this, first of all, if you have any questions, please put your hand up. What we're going to do after this is to provide everyone who's attended today with access to the online platform, which will reiterate everything we've done today. This online platform is a course, which is what we've talked about today. Everybody that attends today gets to use it 100% free, so there's no payment for it. In fact, you have to use it, because if you don't use it, you can't attend the next session, because there is a homework at the end of it for the next session. So Sadoh, I think maybe you share it with everyone on WhatsApp, or I don't know how you share the link to that platform. You have up until the 30th of April to sign in and just go through the different videos. You'll be seeing a lot of my face, because I've just pretty much summarized everything in videos, and we've done an audio part. The slides are also there. And then the last thing is just the 3 questions, which will then help us discuss at the next session that we have. So yes, let's. I'm going to stop here. Sadoh, do you want to take the questions and I answer? Should I pause here and then you take over and then take questions and we can discuss?
Yes. Thank you very much, Dr. Simi. That was really useful.
Yes, menopause is a massive, massive issue, and it has a big impact on mental health. I mean, there's so many things that have an impact on mental health. Menopause is a big one, and I think many of us in this room are in that demographic where you're perimenopausal and you're getting into menopause. And the issue, what I'll say is that awareness is key, and educating ourselves is key. And it's actually 90% of the issue. So if you know that, okay, I'm now in my 40s, perimenopause is going to start very soon. Perimenopause and menopause comes with mental health issues. So you might feel low, you might feel depressed, you lose your sexual drive, lose loss of libido, your body starts to change. You can have an issue. You might then start to have a negative self-image. So if you're aware of that, then you're better able to plan, because there are things that you can do. And also for men, I know there are not many men up on here, andropause is also an issue. So it's not just menopause, there is also andropause, which can also cause issues with mental health. And maybe at another time, Sadoh, you might do a bigger session that involves men. So menopause or hot flushes, so many things can do that. We can do a whole session on menopause alone and just looking at the interventions. But many of the interventions that we will talk about in our 3rd session will also help with menopause. Then clearly there's the issue of medication. So having bioidentical hormone replacement therapy is something that I advocate. It's not common in the Black community to advocate bioidentical hormone replacement therapy, but I certainly think that there is a place for it. And it's something that if you are going through the menopause, that you should consider having hormone replacement therapy if you qualify for that. But so yes, Victoria, that's a very, very important point. Menopause is a big issue and has a big effect on and impact on our mental health, and we should definitely keep an eye on that. So yes, depression, there was a question in the box, I think.
Yeah.
Depression is very common in our community. Black people have more depression. We have lots of depression, but the only issue is that we don't talk about it. we pretend like we don't have it. So so that's the situation that we have. There's a lot of that in the community, and having able to talk about it is important. So there's a question in the box about what are some of the causes of mood swings. It's important to talk about cyclical changes in mood. So as Sadoh said, I run Vine Health and we do some vitamins. And as women, we have the cyclical mood changes. And one of the things I would encourage you to do is to chart your mood. So on a diary. So if you're feeling particularly good, just put it there in your cycle. I'm feeling good today. So that at the end of the month, you can see whether there's batches of where you feel good and where you have mood swings. What you'll find is that after the ovulation period, just before your period, people have a low mood. That's just it's part of evolution. So if you don't get pregnant, your mood goes down. It's just part of what God says, go out and multiply. So if you don't multiply that month, you feel a bit low. So understanding that deep in hormonal levels at that time, and taking things like vitamin B complex is quite useful. Taking vitamin D is also useful. We don't want to go into all the tools today, but that's some of the things. So cycles have a big effect on mood. That's one of the things that will affect your mood, and then all the external factors as well. And one of the things about having a good mental health, somebody said it earlier, is being able to separate yourself from your situation. So knowing that you are not your situation. Situation is happening and it will pass, but you're not your situation. So that's one of the. So mood swings can be caused by anything, but most important, a lot of it is also cyclical as women. And then there's also the issue of work and all the other things we mentioned.
Yeah. The question that came in earlier was, how can I overcome fear and anxiety?
How can I overcome fear and anxiety? Yes, that will be in the third session. Fear is, there's several fears that we have as people that almost, if you're not careful, they are innate. So things like fear of death, fear of losing a loved one, fear of not achieving your potential. So those are not real. The thing about fear is that it hasn't happened. You are just assuming that it will happen. So it's not there. It hasn't happened. And one of the biggest impact things that we can do, again, this is the third session you guys are dragging us into, is it's about silence. Silence, meditation, prayer. Prayer is a form of meditation as well. Being able to stay really still and being able to think, just have nothing in your mind, just being silent. So one of the things, like my routine this morning is the same as my routine every single day. My routine doesn't change. It's the same thing. Wake up, exercise. I didn't go for a run because I'm quarantining. Exercise. The next thing is to, after exercising, the next thing I do is to meditate. So if just meditation for me is trying to understand how my body is feeling. So if I've had a headache or I've had something in the last few days, I want to really be silent and see how am I feeling in my body. Then the next thing is to read my Bible. So open my Bible, read it. And then after I read my Bible, I will pray. When I finish praying, then I will journal. Journal is all the tips we're saying this week. I'll journal. And after journaling, I'll read something that is interesting. So some of the things. I'll take there's another question in the box before I have a raised hand. So let's finish in 3 minutes. Yeah, finish quickly. All right. Please, to what extent is conflict avoidance associated with mental health? I won't call it conflict avoidance. What time do we have? Yeah, we have to pray now. I won't call it conflict. Conflict avoidance is not maybe a great term because you don't want to avoid conflict. You want to not engage in anything that will stress you out, but you have to communicate. So if there's a conflict, what you want to do is address it and say, this is how I'm feeling about what you've said to me. This is how I'm feeling about what you've said, and give the person a chance. But you don't want to go into combat with anyone. I don't want to conflict, but conflict avoidance and learning how to communicate during a conflict situation, again, is a whole session. It's something that I've learned over the last 10, 15 years, and I use with all my friends. And you know, it's being able to address conflicts without fight. Sadoh, can we take the 2 raised hands before we
yeah, sure, yeah.
Thank you. So Temi, you've got the floor, and then Lolade, and then we hand over back to Sadoh. Yeah, thank you for that, Temi. Yeah, I think what will be useful is that if people want to join, they go through the session. So that link that we are sharing about the course, then they'll have a chance to watch back the session. They will have to go through that course that Sadoh has just shared on there. We've made it free for everybody that's attended today. I will leave it up to Sister Sadoh if she wants to leave it free for anybody else who joins after today. We'll have that discussion, but there is an opportunity for other people to join in, but they will have to, because there's no point doing the second session without doing the first. Sadoh, do you agree with what I've said?
Yeah, I think it's to build up. So I think if people want to join, so people can register. Well, I'll send the replay to them that they should watch it. And yeah, I think it's because it's Dr. Simi's class. So I think whatever, she's very strict. She's very strict teacher. From our conversation, she's like, we have to. So, but I'm open. But Dr. Simi, is up to you. Yeah.
No, I'm open as far as they can do what everybody on this group is going to do, which is go back, go through the course, do the assignment, and then just join us. They just need to go. They just need to go through it. I'm happy to make it free for everyone during this course of 3 weeks, so that we can get as many people to hear it as possible. Every issue that you have, if it has lasted more than 2 weeks, please go and see your doctor, whether it's physical or mental. So we don't want patients that will come when they immediately have a fever, they are at the GPs. You know, you don't want our cough, they'll be at the GP. No, we want people that are able to self-care. Self-care is the first care. But anything that you are doing that you have and it hasn't improved after 2 weeks, you need to see your doctor. That excludes emergencies. It excludes, if you suddenly have sudden central chest pain, please don't wait for 2 weeks, that's 999. If you suddenly cannot breathe, that's 999. If you're bleeding, anything that is an emergency, don't leave. But if you're having a bit of a headache or you're having a cough or any of that, self-medicate, self-care first. After 2 weeks, go and see a doctor. If you're feeling sad, a bit low, that's okay. Keep an eye on it. It's okay. Sometimes godly sorrow is important. Sadness has a place in our lives, but it's just that it's not protracted. You know, you might be feeling sad for any reason, but if it goes on longer than 2 weeks, please speak to somebody. It's really, really important. So that's always my benchmark. 2 weeks, 2 weeks, everything should be sorted. If it's not sorted, you should be speaking to somebody.
Yeah, thanks for that guidance.